Welcome to the 4E Waiver Webinar Strategies to Stage and Scale Up Implementation in Child Welfare Systems. As a reminder, today's call is being recorded. At this time, I'd like to turn the conference over to Meredith Pochilli. Please go ahead.
Thanks, Tim. Hi, all, and welcome to today's webinar. Just wanted to go over a few quick housekeeping items. Participants are muted throughout this presentation, but will have an opportunity towards the end of the webinar to address questions by phone. Participants are encouraged to also ask questions by typing in the Q&A pod on the right-hand side of your screen. And you are able to obtain today's PowerPoint presentation by clicking the download button on the lower right files pod. We are pleased also to offer CEUs for this webinar. In order to qualify for CEUs, please ensure that you are logged in at the beginning of the webinar and log out at the end. If you have any technical difficulties during the presentation, please feel free to type them into the Q&A pod or contact us. Following the presentation, you will receive an email with the webinar evaluation and CEU links. At this time, I'd like to turn the presentation over to Susan Maciolek of the Capacity Building Center for States.
Good afternoon, everyone, and thanks for joining us today. I just want to go over the agenda and then make some introductions. First, we'll introduce you to the Center for States and our work. Then we'll move into defining scaling and anchoring, talk about the keys to making replication work, and some attributes that determine scalability. We'll also talk about the strategic choices that managers make when deciding to scale up, different considerations when scaling up, and a number of real-life examples of scaling of the Title IV waiver interventions from our speakers, Cosette Mills and Jennifer Williams. On the next slide, we'll go through some brief introductions. In addition to myself, I'm joined by Cathy Fisher, who is also a member of the Center for States. She's a waiver organizational consultant, as am I. As I mentioned, the two state leaders on the phone with us today, Cosette Mills is the Federal Revenue Manager at the Utah Child and Family Services Agency, and Jennifer Williams is the Assistant Commissioner of Quality Control for In-Home Tennessee. We are very pleased that they are able to join us today, as they will bring a lot of life to the conversations that we plan to have.
So I just want to do a little bit of bio on our guests, Cosette Mills, because they're really the folks who are going to bring all of this conversation to life. Cosette Mills is the Federal Revenue Manager of the state of Utah, the Utah Division of Child and Family Services. She's worked in that role for nearly 20 years, of her more than 30 years of work with state and local governments. She's the project manager for Utah's waiver, 4E waiver, which is called HomeWorks. The other guest with us today is Jennifer Williams, who is, as I mentioned, the Assistant Commissioner for Quality Control and Director for In-Home Tennessee for the state of Tennessee Department of Children's Services. In-Home Tennessee oversees the design, implementation, and sustainability of that state's 4E waiver. Jennifer's been working in child welfare for many years and started with training in Middle Tennessee State University, and she brings a wealth of knowledge as well. So the purpose for today's webinar is to really explore the application of implementation science principles to the decisions about staging and scaling implementation of new programs and practices. I'm going to ask Cathy to do a little bit of background on the Capacity Building Center before we get started.
Thanks, Susan. I'm hoping that our audio is improved at this point as we're getting warmed up for the afternoon. I want to talk a little bit about the Capacity Building Collaborative before our presentation begins today. In October 2014, ICF was awarded a contract by the U.S. Department of Health and Human Services Administration for Children and Families, the Children's Bureau, to establish the new Child Welfare Building Collaborative. The Center for States, the Center for Tribes, and the Center for Courts are partners who form the Capacity Building Collaborative that consolidates services that had previously been provided by the National Child Welfare Resource Centers. And this consolidation increases coordination, leverages resources, and provides a more strategic service provision across the centers. Our goal is to work with the jurisdictions and our partners to support capacity building, leading to a more improved outcomes for children and families. We do this by partnering with states, territories, and tribes and courts to identify, design, and implement innovative solutions that meet the unique needs of each of our jurisdictions. The Center for States serves states and territorial public child welfare agencies and also Title 40 waiver demonstrations.
A map of the United States divided by the 10 federal regions.
ICF International supports the Center for States with Maggie Bishop as our project director. You might recognize ICF from our work with the Child Welfare Information Gateway, as ICF has a long history of working on technical assistance contracts with the Children's Bureau and other governmental agencies. The Center for States really aims to provide evidence-based capacity-building support services that will improve performance and support our states and territories in effectively initiating, implementing, and sustaining change and innovation. To achieve this goal, we really work with our partners to create and deliver coordinated, inclusive, and well-informed capacity-building services. The Center for States is designed to support the Children's Bureau vision of providing strategic, evidence-informed services to build the capacity of state and territorial public child welfare agencies.
Terrific. So just to review for today what we hope you all get from today's webinar, we've got a few objectives. The first, understanding the key elements of a staged implementation plan, looking at scaling and staging strategies through an implementation science lens, exploring some of the research on effective scaling up, and then sharing successful strategies used to scale up into waiver jurisdictions.
Back to you, Cathy. Thank you. So just want to start out with a definition to ground us today. One of the observations we made when researching for this webinar was that there wasn't a whole lot out there in terms of information about scaling up, particularly in child welfare organizations, probably because that hasn't been done a lot across the country. So we found some research in child welfare and then looked elsewhere and found some other what we think is helpful information. This definition, coming from the World Health Organization, looks at scaling up as deliberate efforts to increase the impact of successfully tested innovations so that they benefit more people and foster policy and program development on a lasting basis.
2010, 9 steps for developing a scaling up strategy.
That was one grounding definition that we found. The next slide, we just really want to talk a little bit about this idea of scaling and how people sort of refer to scaling in a different way when you have conversations about it across the states. We've also heard it referred to as a rollout, as staging, as replication. Oftentimes, child welfare agencies see the rollout idea as something that's really a technical mapping process, trying to decide where and when that they should go next with their innovation or their implementation. We realize that the scaling process requires sort of both these technical elements as well as adaptive approaches to the work. It involves really planning across the installation and implementation stages. And also this idea of scaling builds on learning from implementation readiness and also learning from the testing of the intervention. So those are all aspects of scaling and ways that we're informed, particularly looking at this idea of building on learning around implementation readiness and testing the intervention. This idea of using data that you've gathered to inform those scaling decisions really critical to being successful. We wanted to pull out for you this report, which is available to you on the Children's Bureau website, and share it with you.
The slide shows a cover of a publication, Supporting Evidence-Based Home Visiting to Prevent Child Maltreatment, Making Replication Work, Building Infrastructure to Implement, Scale Up, and Sustain Evidence-Based Early Childhood Home Visiting Programs with Fidelity. The publication shows logos for Mathematica Policy Research, the Children's Bureau, and Chapin Hall. There are photos on the cover: prospective dad with arms around pregnant mom, moms with their babies, and dad and mom with baby.
It's from January 2014, and it's a report on implementation of home visiting programs. Really provides some important findings around scaling and sustainability of evidence-based home visiting programs. And again, we encourage you to take a deep look at this report available on the Children's Bureau website. Next slide, please. The next couple of slides are really an opportunity to pull out information from the report. First of all, the idea of an element that was really crucial in supporting scaling and sustainability is this idea of partnership. And in the research, they found that the degree of shared work among the partners, the idea of having shared goals among the partners, and particularly the quality of that collaboration was really an important factor in determining how successful they would be at scaling and sustaining intervention. So looking at partnerships, not just in terms of this idea that we develop sound partnerships at the beginning of implementation, which often happens, and we try to get our partners on board, but that we sustain those partnerships through doing shared work together across the course of the implementation.
The slide contains a graphic of two people holding hands about to walk on a road together, symbolized by an arrow. Milestones on the road are degree of shared work, shared goals, and quality of collaboration/supports, scaling, and sustaining.
The other area that was part of the report really looked at this idea of building infrastructure. This idea of infrastructure needing to be built across the course of implementation.
An illustration shows 3 interlocking gears. 1. Foundational infrastructure. 2. Implementation infrastructure. And 3. Sustaining infrastructure.
So taking first of all this idea at the beginning work that's happening in implementation during the discovery stage, during the installation stages, that's when the organizations really need to put foundational infrastructure in place. This idea of having good research, doing good planning, having good coordination, strategic planning and decision making, aligning your goals in terms of the goals with the overall organization and the interventions that you're implementing. Moving on, as you progress through implementation, this idea of looking at implementation infrastructure, where we focus more on the operations of the agency and also on the workforce. So in terms of operations, we'd be looking at things like the screening and assessment procedures, the intake procedures, and what's supporting those actual processes, business processes. And when we look at the workforce, we really would be focusing during that implementation stage around training, coaching, supervision, the technical assistance needed to support the workforce. Again, throughout the implementation, all these levels of infrastructure are important. It's just that during certain points, they become more salient. So during the implementation stage, a heavy focus on operations and workforce. And finally, the research looked at this idea of sustaining infrastructure. So what does it take to really sustain the innovation? So they found that things like fiscal support, community and political support, ongoing communication and evaluation really correlated positively with this idea of having effective scaling and sustaining those interventions. So also to consider this, that the idea that we need budget, we need the resources to anchor and support the scaling of the intervention was also found to be critical. The next slide just really brings these things together. So this idea of bringing together both partnerships and the context for ensuring quality collaboration among the partners, as well as bringing together that idea of sustaining infrastructure, that those two elements in particular have a substantial impact on the ability of an organization to effectively scale and sustain an intervention.
The slide shows how bringing partners together, creating the context for ensuring quality collaboration among partners, and creating sustaining infrastructure allow organizations to effectively implement, scale, and sustain an intervention. The EBHV infrastructure areas include foundation infrastructure, implementation infrastructure, and sustaining infrastructure. Sustaining infrastructure includes fiscal capacity building, building community and political support, strategic communication, and evaluation. EBHV partner context, or quality of the collaboration among partners, is the extent to which partners work together and there is goal alignment among partners. EBHV infrastructure areas and EBHV partnership context are both associated with the EBHV initiative goals of implementing with fidelity, which includes scaling up and sustaining the intervention.
And lastly, I think a lot of talk right now in the child welfare field on using data to inform decision making is particularly important when looking at scaling intervention. So this idea that clarifying the differences between the perceptions of progress that you've made in implementation and the real findings and what the data tells you about the progress that you've made in implementation is a critical element in looking at scaling. Developing an understanding of the strengths and weaknesses of your implementation through looking at the data, and really using the data to target what are usually limited resources to support the scaling effort. So not sort of blanketly putting out additional resources, but really targeting them using that informed data decision making. And then lastly, this idea of looking at data in order to ensure that you really have timely, reliable, and useful information that can really provide quality data for field administrators, for funders, for policy making. Those key partners needing to stay highly engaged throughout the implementation and really being and understanding what progress you're making so that they will continue to provide that all-important resource support as you work to scale and sustain any kind of innovation or intervention. I'm going to turn it back to Susan Maciolek so she can talk a little bit more deeply about scaling up perspective.
Thanks, Cathy. So as in everything in child welfare, there are always multiple perspectives to consider. We just wanted to highlight these two particular perspectives, those of central office or agency leaders and those of regional or area leaders and their staff. So looking inside the agency at how these decisions might play out from those different perspectives. And really looking at the kinds of considerations which are not the same across those groups necessarily, and trying to understand how to think them through.
The slide includes perspectives of central office and regional leaders. Central office leaders make decisions about whether to expand or scale into different areas or regions. Regional leaders decide to support the innovation being scaled in their office, which looks like the adoption decision.
So the next slide takes the perspective of the strategic choices in developing up the plan. This is more of the senior executive agency leadership considerations. And what we wanted to just preface the next two slides on was the idea that having started the innovation, having introduced something very new to an initial pilot site and perhaps finding the early adopters of the organization, we're now at a point in the process where we're talking about scaling, whether we think of that as rolling out or staging or scaling, whatever language we use. We're moving from that first place to the next subsequent site and thinking through how that might play out. And wanted to highlight for folks to consider the value of the lessons learned through that first site in informing subsequent decisions. So you'll see on this slide there are a number of considerations that senior leaders need to account for.
The slide contains a table with two column headings, strategic choice areas and considerations. 3 choice areas and 3 sets of considerations are shown. Area 1, organizational processes. Considerations are: how many sites are expected to adopt the innovation? During which time period will expansion take place? Will implementation be phased or rapid? What are feasible short-term expectations? What are mid-term expectations? What are long-term goals? Are there major differences among sites? If so, what adaptations to the innovation are needed? Will new partners be brought in to support or implement scaling up? Will the approach be participatory? Area 2, cost. Considerations are: will the costs of expansion be the same for each new area? Are economies of scale possible? Can expansion be more efficiently organized? Are resources for expansion available, or do they need to be mobilized? If so, how? Area 3, monitoring/evaluation. Considerations are: how will the process, outcomes, and impact of moving to scale be monitored and evaluated? Are the innovations continuing to have the intended outcomes and impacts that were demonstrated in the initial stage?
So the expectations of what they want to gain from the intervention, or interventions because we're often implementing more than one. There are some similarities but some differences in those decisions that we make when we first initially implement or adopt in a pilot site and the ones that we need to consider as we move forward to subsequent sites. Adjustments, the first set of lessons around from the pilot site, as Cathy said, as we look at the data and we engage partners, can inform some of the adjustments we might need to consider making as we move from one site to subsequent sites, whether there are economies of scale to be had in the resources as they're allocated, or whether additional resources are needed to move from the first site to subsequent sites, and how that those decisions can now be informed by real on-the-ground learning from that first pilot site. And then, of course, the challenge of both keeping an eye on the continual use of the new interventions in the first site as we move to subsequent sites is important. And so this grid is really intended to lay out a number of those considerations that agency leaders are juggling, and doing it in the frame of the benefit of learning from the first site as we inform our scaling up and expansion strategies. So the next set of perspectives on the next slide looks at the potential new users' perspective.
The slide provides key questions in several categories for a new user's perspective. Relative advantage. Do new users perceive the innovation as better than the previous program practice in terms that matter to those users? That is, economic advantage, social prestige, convenience, or satisfaction? Compatibility. Is the innovation seen as consistent with existing values, experiences, and needs of new users? Complexity. Is the innovation perceived to be difficult to understand and use? Trialability. Can users test or experiment with the innovation on a limited, virtual, or vicarious basis? A triable innovation reduces uncertainty. Observability. Are the outcomes of an innovation visible to others? Visible results lower uncertainty and also stimulate discussion. Source: Rogers Diffusion of Innovations.
So imagine that you are not in the first pilot site, you're in the subsequent site, and for you, these new users might be thinking about this as really experiencing the adoption decision. For them, this is a new intervention, and they're coming at it fresh. And this grid, people are probably familiar with Rogers Diffusion of Innovations. It's cited in a lot of places. We in child welfare have benefited from this framework, and you see massaged and presented in a lot of different forums. So wanted to put in front of us today the considerations from Rogers research on what users consider when they're deciding to adopt something new. And although the agency might have already made a commitment to using these new interventions in their 4E waiver, subsequent sites are experiencing this as a new intervention, and they will also go through these considerations. And the notion of the pilot site being a place that gives these subsequent users a place to explore the relative advantages of the interventions, how it's compatible with the agency's value system and experiences, how complex is it to use, can it be tried, either directly or by calling colleagues in the new pilot site or having the pilot site staff share their experiences with subsequent sites to address the concerns of triability and observability. By laying these out, we think Rogers' framework helps us think about how to engage users in subsequent sites and assessing what's ready to commit and what they might want to consider as they move from pilot site to subsequent sites. That's it for presenting some of the research that we wanted to share. And now I want to bring in our experts for today and turn it over to Cosette Mills to talk about her experiences in Utah.
Great, thank you. Utah is a state-administered child welfare system, and we have 5 regions. The state's divided geographically into 5 regions with 26 offices, just to give you a sense of perspective. For us, we have a few pockets of areas, but much of our state is quite rural. 2 of our regions have over 1 million square miles in them, but not large populations, so that creates some unique challenges for us. As we approached our 4E demonstration project, we identified 3 phases for the project, actually 4, but 3 that are rolling out to the regions. And we made a decision with those phases that we would, each individual phase would roll out on a staggered basis to the regions, but then also the phases are staggered. So that created a certain amount of complexity for us, but we felt that that also made it a little more manageable for our regions to implement. So in our first phase, we had 2 primary components. That was implementation of a Kansas-based tool called the Utah Family Tool, and also some training and skill building specifically for the Child Welfare Agency caseworkers, utilizing the Strengthening Families Protective Factors framework developed by the Center for the Study of Social Policy. This particular phase we rolled out, first of all, by starting with 2 pilot sites. We decided to have the 2 pilot sites within the same region for ease of coordination. And one site was more urban and one was more rural. And actually the region directors helped guide us in selecting those pilots. We originally had planned to do one urban site in northern and a rural site in a different region, but it was our regional directors who said that for implementation they thought it would be much easier if we used a single region, which now we're very grateful for. That was very wise. We then, as you can see on the chart, we staggered the rollout for this across the different regions over about a 2-year period. The one thing that we did that was sort of an experiment, but we're really happy that we did, was we created an implementation plan that included a pre-implementation preparation period where we worked with the regions. We used a period we called it implementation launch, just the kind of the kickoff, the training, getting it started, and then we've developed post-implementation supports that we worked with our regions on. And we utilized this same process for all of our regions as we implemented this phase. Obviously, there was overlap to be able to achieve the timelines, and that was a little complex, but it really helped. So that gives you some perspective. And that we are, for Utah, we are targeting adults and children receiving in-home services primarily. The second phase of our waiver is an updated structured decision-making safety assessment tool and safety planning training. And we again started with a pilot site for that, which was November of 2015. And we are now doing kind of an overlapping rollout for the regions. More of the regions felt they were ready, and so we've all of the regions will actually have received the basic training for implementation of this. Actually, by July, just this past week, our last region said they wanted to move it up. So that one is currently being implemented. And again, we use the same structure in terms of pre-implementation discussions with the regions, the implementation launch period, and then post-supports. And then our phase 3 will be our trauma-informed child welfare system training and trauma resources, which we're still really in the developmental phases for that.
Phase 3 will roll out in 2017.
The focus of what we wanted to share today was really around the lessons that we learned as we used this scaling process. So we've identified really 5 lessons learned. The first one was the importance of the leadership or management structure that at the state level to guide the process. It was really important that we had full agency support for this, including a commitment to meet frequently and for the duration of the project. We also included in that, we created what we call the waiver leadership team, and on that team we included agency decision makers, we included directors from the region, so we always kept the region perspective in mind, and also members of the evaluation team, in addition to others who were involved in development and implementation of the waiver. we've really benefited from consistent membership over time on this committee. Most of the members have stayed consistent through the whole period, and this team actually started during our developmental phase and has continued through the implementation or the phases as we've rolled them out to the regions. The other thing that was very important for us in this is that all of our waiver components, all of each of these phases were all coordinated by the same leadership group. So it wasn't as if each of those were being independently developed and taken out to the regions. It was all coordinated, and that's been extremely important. The other thing that this group's been able to do is stay connected to the larger agency efforts. We know that our demonstration project isn't the only thing going on in the agency, so it's allowed us to really coordinate in conjunction with all of those other kinds of efforts as well. And we've had to adapt our based on other things going on as we were trying to take into consideration what the regions had the capacity to do. The other thing that was really important for our waiver leadership team was that members of this team also are part of our state leadership team, which is the state oversight body for the Child Welfare Organization. And the communication with that state leadership team, which includes all of our regional directors as well as our state level administrators, has been very important. So we think that management structure, having something in place that's going to be able to support you throughout the project, is critical. The second area, and I would say this is actually the thing we've gotten the most positive response about, was our what I would call intentional pre- and post-implementation work with the regions. One of the things that we did is we created a small core team, we call it the Homeworks team, that has worked directly with region administrative teams. And we created a process for pre-implementation work with them for a period of about 9 months before we ever started training in any region. And this really led to buy-in and development of relationships with the regions. I think one of the things that was most important for our Homeworks team that worked with the regions was being responsive to the regions, seeking their input, listening to their questions, responding to their concerns, and not being defensive, but looking at really where we could adapt and make changes based on an individual region's circumstances. I think this ultimately resulted in smoother rollouts to each of the regions and really opened the door for continuing communication as we've continued to work to achieve full fidelity in each of the regions. I think some of the things that created opportunities for one was just really frank two-way communication. We have an example. When we first went into each region, they were a little suspect. It's like, we've never had this before. What are you doing here? And and we tried to present what we were going to do, and that we were going to come, and we were going to meet with them regularly, and we were going to have these open conversations. And in one particular region, after about 2 or 3 meetings with them, we could just tell that it wasn't opening the doors we'd seen in the earlier regions. And so we finally just came in and said, we're hearing that it seems like we're hiding something, or that that somehow we've got something up our sleeves or whatever. But it really, just a frank putting it on the table, really opened the doors, and that totally turned that relationship around. And that relationship with the region leadership became critical as we were able to then address issues and challenges that came along, because both sides felt like they could be real. In this pre-implementation time, one of the things we did is really worked with each region to look at the specifics for the logistics that would work for their regions, for how the implementation launch would work and what kind of implementation post supports we would provide. It also gave us the opportunity to anticipate and plan for what the impact was going to be on staff, to be able to address things like pockets of resistance and other concerns, and to address some of the unique cultural aspects for each region. It's also created a great opportunity for problem solving, and I think the regions have felt like they've got an ongoing voice in the process, and I think ultimately has helped them accept ownership that they are responsible for implementation. I remember one of our regional directors, as we were doing an introduction with their supervisors, and And this regional director said, it's the people here in this room who are responsible to make sure this happens. And I loved that she shared that ownership with everybody, and it really made a difference. And then this pre-implementation time just really helped inform timing, not only for the initial phases, but we've used the same process for subsequent phases. The third lesson learned was really looking at, as you're looking at your implementation capacity, you've got to think about what your capacity is over time. I know as we started our pilots, we brought all of these resources in and all, just really pulled out, all of our best efforts, and it went pretty well. We learned a lot, and then we started looking at, can we keep the same level of capacity for every site that we're going to be going to, or do they get something that's kind of less? And we really had to analyze that, and ultimately our team that was doing that was primarily responsible for the rollout said everybody deserves the same opportunity. They deserve the identical training, the same trainers. So I think just thinking about how do we ensure, if we're really expecting consistent implementation from site to site, what do we give them that will let them be able to adapt or adopt it and implement it? So that is something we chose to do. And so ultimately for us it required we really had to assess our capacity to do that over time, and the amount of time commitment, the amount of travel that would require. We're a fairly large state geographically, and had to do a lot of travel to do this. But one of the things that, again, we got the regions expressed a high level of satisfaction for the in-person presence and support that they've got from the state office team. Because it wasn't only just an initial training, initial rollout, but we also created a post-training supports that have continued for up to a year. We did brown bags for multiple months that we took to every single office during the training period, as well as continuing meetings with their administrative teams, with their supervisors, to provide them support and answer questions. So again, as you're thinking about what you're going to do, just think about what do you really have the capacity to do, and how long will that need to continue. The next area was just the great benefit from cross-region sharing. We created opportunities early on to have regions learn from one another, both at an administrative level, but also even at a practice level, more at the supervisory level than direct workers. But and some of these, the state office team, the homeworks team initiated, but in other instances, the regions began to request these and initiate these on their own. And because the homeworks team was present in every region and we were doing all these activities in the different areas of the state, we were able to see and hear success stories and experiences shared with other regions that I think was extremely beneficial. And then, and now that we've got the phase one now in all of our regions, we're now also taking the opportunity in some existing state leadership. We have a quarterly state leadership meeting that includes all the region administrative teams as well as the state office team. And we're using that meeting to also continue some cross-region sharing, some problem solving, some sharing of successes, and that it's been really beneficial for the regions to be able to help share with each other, and I think in many ways, they kind of trust each other's stories more than having someone from the state office tell of that experience. So we think that's been really important. And then just the last one I would share is to realize how important your evaluation team can be to provide you feedback along the way to help you improve. Someone gave me advice when we were first starting the waiver, was that we should work closely with our evaluation team throughout the whole process, see them as a member of the team in effect, and be able to ask for their input along the way and be willing to make adjustments. So, for example, feedback from our evaluators early on in some of the early trainings in the first region led to us to be able to make improvements in the curriculum and presentations in subsequent regions. Also, as regions were implementing and as evaluators were going in to begin to evaluate for fidelity, we were able to take information learned from one region and be able to share it with subsequent regions to be able to say, in this region, here's some of the areas they struggled with early on, so to be aware of those and be able to share that. So that was very helpful. And then the evaluators also have been able to inform us on things from other research and that have been valuable to help us as we've implemented. So anyway, that's enough of those. I'll hand it off here now to Jennifer, and we'll be open for questions later on.
Thank you, Cosette. I'm Jennifer Williams, and I'm the Assistant Commissioner over our In-Home Tennessee initiative. And our In-Home Tennessee initiative is what we called our 4E waiver project, and also incorporated several other components besides the demonstration interventions that we are doing. We were actually granted our 4E waiver in October of 2013, but we did not start full implementation until October 1st of 2014. So we actually took a whole year in the planning process to make sure that we really laid a strong foundation. Our first intervention that we rolled out statewide, we are a we're a state administered system, and was called the Family Advocacy Support Tool. The FAST. Several of you guys might be using the FAST or familiar with the FAST, but we took our FAST and actually modified our FAST and kind of turned it into a FAST 2.0 with Dr. Lyons. And we removed several of the questions and indicators, and then we also built in a risk factor, safety factor, and a trauma component. So we actually get 3 pieces of information by using our FAST. We started out in East Tennessee in 4 regions and piloted there. We actually started the pilot before we started the statewide implementation in October 1 of 2014. We started our pilot in February of 2014. And then after the pilot was going smoothly, and we started to get into our SASQUIS, our SASQUIS system is TFAX. That took some time. We started to roll it out across the entire state, and we were able to roll it out into 95 counties by June of 2015. And this included all our non-custodial population age 0 to 17. And so the FAST has been very successful. We are receiving all kinds of data from Chapin Hall regarding the use of the FAST, and we have some very strong CQI teams that have been developed that are really doing deeper dives into that FAST 2.0 data to really start to identify trends in our practice so that we can really start to move towards the outcomes that we want to see within our 4E waiver. And so that was phased in over that period of time. On the next slide, you'll see our next intervention, which is KEEP. And we chose keeping foster and kinship parents trained and supported. That's an evidence-based intervention for foster parents. And it consists of a 16-week, 90 minutes a week foster parent training. A lot of people initially were like, I don't know if we'll get foster parents to want to attend that level of training and commit that amount of time. But what we have received overwhelmingly has been extremely positive. Foster parents don't want to see their KEEP groups actually end. They're really very nice. We put together support groups where they go through a standardized curriculum that is actually delivered by our frontline staff or staff that is out into the field. We have some specialty staff like skilled facilitators, resource parent support. So it is not an intervention that is delivered by the training department. So it is actually delivered by field staff. And so that makes it very unique and required a lot of infrastructure because we know we had to get caseloads down. Caseloads had to be around 12 to successfully become a KEEP facilitator, KEEP leaders, group leaders, what we call them, to put that intervention into place. And so that took some time. So we started planning that in January of 2015, and we didn't actually start delivering our first training to our frontline staff until June of 2015. So we spent quite a few months really concentrating on that. what makes also KEEP unique is we actually offer a $1.50 a day board rate incentive increase for foster families that complete KEEP that have kids in their homes from 4 to 12. We also offer sitter service, meals, and transportation for our KEEP groups. And so we really have made it a very comfortable and inviting environment for our foster parents. The majority of our KEEP groups are held in local churches and not within the DCS offices.
The slide includes additional information about Tennessee's KEEP project. DCS developed a phased implementation plan targeting 4 regions and 10 counties. DCS trained the first county in June 2015 and the last county in September 2015. The first group of foster parents graduated in December 2015. The population focus for KEEP is foster parents fostering children ages 4 through 12.
The next intervention we had is the R3 casework strategy. This is actually not necessarily in our IDER that a lot of you guys are very familiar with. Is not actually a intervention. We are calling it a casework strategy. And that's really how ACYF viewed it, because it was an evidence-informed, not an evidence-based, and it was more of a strategy to improve supervision and to improve relationships with between caseworkers and families versus an actual intervention. And so we started planning in August of 2015. We focused originally on the first same 10 pilot counties, and that's where we've started, always in the same 10 pilot counties. We have not expanded R3 past the 10 pilot counties, but we have expanded KEEP into an additional 14 counties. So we have 24 counties that'll be up and going with KEEP. The expansion actually starts next week with the training of the staff. And so what the casework strategy does is the supervisors are trained in a one-day training, and then the frontline staff, their staff that they supervise, is trained in a half-a-day training. And they hold monthly group case conferences that are recorded and videoed, uploaded to the model developer staff, which is the Oregon Development Institute, I think, and ODI, Patty Chamberlain's group. And then supervisors get direct coaching feedback from the model developer staff. And then we get fidelity ratings on our supervisors. So in the past, when we did supervisor training, we sat them down, they went through training, and then we told them to go do. And what makes this very unique is now we actually get to see and have evidence of, are they actually going and doing. And then the goal is that the frontline staff will then replicate that with the foster parents and the birth parents, especially birth parents that they're working with. And so our whole theory of change around this was that if we strengthened our assessment, we could get improved services on the front end. If we strengthened our foster parent supports, we could help reduce our length of stay. And if we enhanced our supervision strategies, that would have an effect both on our admissions and length of stay. So we kind of layered our interventions, and they all started out in the same 10 pilot counties, but then at different phases have rolled out. The FAST, as I said, is now statewide. KEEP has rolled out into an additional 14 counties with a plan for it to move into 2 more regions, which will be about another 20 counties. And then R3 is currently in the original 10 counties, and we're just exploring whether or not we wish to continue to expand that. Some of our lessons learned in scaling is we needed to be very specific and detailed with that overall vision and rollout plan that I just kind of talked about. We needed everyone to really share the same vision and have an understanding of what that rollout plan looks like. And that is actually a very valuable lesson because we are looking at expanding across the state. And Cosette mentioned, you know, when you go into expansion, you kind of talk about do they get the same supports as the original that you started out with? And we did not originally, with our rollout and expansion, really connect the vision and the rollout plan to the newer counties and regions. And so they struggled at the beginning, and we're now going back and backtracking. So I really stress that as you roll it out, that everyone is sharing that vision and the plan. The other piece is the strong infrastructure to support the rollout. We actually have a group, we call it our state implementation team, that meets every Friday morning at 7 a.m. and really works on making sure that we have that strong infrastructure. And at that meeting is our commissioner of the department, the assistant commissioners, the deputy commissioners, the fiscal assistant commissioner, training, CQI. Everyone is at that table that has a piece in this. And we really look at this as a department-wide intervention that we're working on, so everyone needs to have a piece of ownership in that. And so that has been very successful, especially in our original 10 pilot counties, especially since we spent all that time developing that infrastructure, and we're now doing that in our other counties as we roll out. The other piece that we have really started to really strengthen is we already in Tennessee had a strong continuous quality improvement process. But what we have seen is through the strategic levers of the 4E waiver and the flexibility with funding and all the evaluation data that we are receiving from Chapin Hall, our evaluator, that we really have an opportunity to enhance our CQI process and use that to help drive practice change. And so that is something that we have really been incorporating quite a bit of data. And we are really becoming, I know everyone says that they're a data-driven system, but Tennessee is really moving there. We now have a report that goes out monthly, and our regions have a baseline, a target, and an actual of where their custody numbers currently are. So they have a baseline that they started on July 1 of 2014, and then every month they put in their actuals, and they actually have a target goal that they sat down with the commissioner and the assistant director of fiscal and established their target goal of how much they were going to reduce admissions and how they were going to reduce care days and length of stay. And so that's been very exciting for them to really start to think about data and how that has an impact on your 4E waiver, especially with the finance mechanisms with that. That it's amazing that if a child is safe enough to go home on Monday, then why aren't they on Friday to save 2 cares a day? What are we looking at? You know, what are the barriers? We're addressing court barriers. Are TPRs getting filed timely? Is paperwork getting done? Are the court dockets too full to move kids to permanency? And so all this data that we're gathering through our 4E waiver is really starting to inform those practice changes. So on the next slide is, as I was talking about, the actual interventions that we're doing are just a small piece of this. We also had to look at where our staff was developmentally and where they were in their overall satisfaction with the department. Because if we didn't address morale issues, we could have the strongest infrastructure and the best interventions out there, but they weren't going to be successful if we didn't have that buy-in piece. And so those are things that we're constantly looking at. We actually completed through our evaluation a time use analysis study, and we're looking at where staff say that they're spending time. We've also done quite a bit around satisfaction and really are looking at how do we increase morale, because these interventions really, they're expensive. And so, and putting staff through that training can be, it's expensive, it's timely, and so we want to make sure that we're retaining the staff and supporting them in this so that we're not necessarily having to continuously start over again. Constantly looking at the stress levels of what we're doing with regions. I've had some regions where we thought about moving into a little bit faster, and it's like if we add one more thing onto this region, I think everyone is going to walk out the front door. So not even looking at just what we're asking with them with our evidence-based interventions, implementation, and that piece, everything else that is currently on them and what they're all dealing with, different review processes. We just got out of a children's rights, or when it moved into maintenance, into a children's rights lawsuit. So there's lots of pieces there that they've been working very diligently on, and just acknowledging that. And then the last big lesson learned, and we can't repeat it enough, communication, you cannot repeat it enough, as I just said. You have to repeat yourself over and over. And that is just something that we think we have repeated it enough, and it's like, and you think everyone heard the same message because they were all on the same Polycom, because all our meetings are pretty much done by Polycom. But then you get to the next meeting, and it's like, wait a minute, we just had that conversation last week and made these decisions. Because we all know when people are on Polycoms, people come in and out of the office. Some days they're really tuned in, some days they're not tuned in. We've all been guilty of that. And so we constantly are repeating. In addition to repeating ourselves and making sure that everyone has a shared vision and understanding of what's expected, we take very detailed minutes for all our meetings that are posted on a shared drive. We have very detailed agendas for all our meetings, and my staff have been extremely excellent in putting out those high-quality written products, and also in developing manuals and moving forward, and really putting all decision points in writing so we don't keep going back and forth and backtracking. It's no, we decided this on this date, it's in writing, we're not moving forward, and not changing our mind unless data shows something else needs to be done. And so we just had excellent communication, and I just can't brag enough about the excellent staff that I have, and actually one of them's on the call, and I'll just give her a little shout out, but Ashley Ragland has been super in developing all these written materials and keeping all those pieces moving together. And I think we're ready to move on to questions.
Susan replies.
Yeah, thanks so much, Jennifer and Cosette. We are ready to move on to questions, and so as we noted at the top of the webinar, you can use the chat box to put any kind of question in there. We're looking at it closely, and we'll answer the questions as they come up.
Kathy replies.
Both our presenters are able to respond to questions. It looks like we have one. This could go for either Cosette or for Jennifer. You've had such a broad amount of experience working on the waiver and moving through implementation and scaling this. We're just wondering, is there something, or are there things that you would do differently knowing what you know now and what you've done around moving this across your state? Either one of you want to jump in?
Cosette replies.
I could share a couple thoughts on that, and then to be followed by Jennifer if she has some things to add. This is Cosette. I think if we were going to do something differently, one of the things we would have done is to create more capacity to support more intensive coaching efforts for our region staff. That's an area that we deal with. I'm actually going to find out more from Jennifer about what they're doing with the videoed coaching and feedback. That's an area I think that to really have a plan for that. Also, one of the things that we wish we had done early on was just be mindful of ways to capture records for things like success stories, that be able to share those, because what we found is that's where our region staff start to really be able to grasp how to make the changes when they hear how something that's been utilized with a family has worked well, to be able to capture those a little more effectively. One of the other things that we might have looked at was reducing the number of initiatives that regions were expected to implement in a short period of time. We know that regions have constant challenges. We have challenges with turnover. We've had hiring, which resulted in hiring a large number of new workers. Obviously, there's limited financial resources, and so as they were struggling with day-to-day, we're adding all these initiatives on top. And I'm not saying we don't want to make the improvements, but to just be really mindful of that, of the impact on the regions. Those are probably the key ones I would maybe do differently.
Susan replies.
Jennifer, did you want to chime in on your thoughts about what you might have done differently?
I think something I would have done differently is on the front end, planned for 5 years out. We were so focused in our initial planning that we were just looking at, let's get it rolled out, let's get it started. And so we didn't have a strong rollout plan for statewide at the beginning. And I think it would have been, the entire state would have taken more ownership if we would have had that at the beginning and communicated that. And so we had to do a lot of backtracking because we started out in 10 counties in East Tennessee, which includes like Knoxville. Staff members in Memphis, which is clear at the other end of the state, didn't see themselves as part of this 4E waiver demonstration project and would often say, well, that's just something they're doing over there in those 10 pilot counties in East Tennessee. And so we didn't really communicate how this was going to come to everyone. And I think another lesson learned is why we have it built in now. We're still struggling a little bit with it, is having that full sustainability plan pretty much drafted out before you even start rolling out. You need to know how you're going to sustain it and moving forward.
Cathy replies.
Thanks, Jennifer. I think we have another question. Susan?
So this goes to the question of scaling not just a particular intervention geographically, but scaling by folding in new interventions. So the question about as new interventions come online, do you do an analysis of how the new work would integrate with existing practice and training?
Cosette replies.
I was in Utah. We did. I think we have a practice model that's been longstanding in our state, and we've never felt that our practice model needed to be, or at least we didn't, as a result of our waiver, feel like our practice model needed to be revamped, but could perhaps be enhanced. So all of our analysis for new interventions, at least particularly things that our staff were going to do, which is, the first areas we focused on in the waiver, were to be able to say, do these fit with practice model, and if so, in what way, and how can we roll them out in a way that shows that? So we were able to, for example, our protective factors for our caseworkers, our practice model, at least practice model skills are really looking at how we engage, how we team, how we assess, how we plan, and how we intervene. That's kind of a core piece of it. And so we were able to then say for each of, as we've looked at both our tool, our CANS-based tool, our UFACET, and also our skills training for caseworkers, be able to then tie back to all of those specific practice model skills that workers are using and really look at how does this just help them be able to do those things better, as opposed to feeling like it's, oh no, yet something new on top of what we're doing. And one of our regions kind of said, oh, it's practice model on steroids is kind of the way they talked about it. So now as we're looking at continuing to sustain now that we've rolled out, we are now rolling this into, for example, new employee training. As they teach the model, they'll now just incorporate these new pieces as part of the existing practice.
Susan replies.
Great. Thanks, Cosette, for that. We have another question that's come in just about scaling. So for either of you, what changes can be made midstream in the scaling process, and if you made those changes, how would you approach this? So if you already had a plan and then there was a need to make changes, what did you do about that?
Jennifer replies.
We're kind of still in the process of scaling, but now I will say with the FAST, sometimes we had to slow down with the changes, or we had to go to another area of the state first. Because of the trainers and supports were actually out on maternity leave. And so that kind of put a snag in our plan. We were going to get that region up and going, but when all your trainers, the 3 trainers you got, or 2 trainers you have, are both out on maternity leave, that makes it very difficult. So that's something, was the adjustability in where we went next as we were rolling out and scaling interventions up, and really acknowledging the amount of time it's going to take to scale it up. So that is some of those things of just realizing that no, it's going to take a little bit more time. Why, yes, you're going to miss deadlines. And just understanding that just because you miss a deadline doesn't mean that the project has failed. It means you're responding to the needs of the region, you're utilizing the data in a different way, and that you're just really trying to ensure that you're doing good practices and moving forward and scaling up.
Cosette replies.
Yeah, and I would add to that, thanks Jennifer, some of the things that we had to, I feel like you have to approach your plan with a certain amount of flexibility. So as Jennifer mentioned, we also had to change our sequence for the rollout for the first phase because of some challenges that were happening in one region. Another thing that we didn't expect was after we had implemented in our pilot sites and the rest of that region, the other regions were so excited, they asked us to accelerate the rollout, which, if you remember our timeline, we have this 9-month pre-plus, then the 2 to 3 month rollout, and then the post. We had to really just even lay it all out on a Gantt chart to say, could we physically move this up in months, and which ultimately we did. But because of that acceleration, we then had to make an effort to delay another of our phases further. So our trauma phase got so we could accelerate the first phase. So it's just a certain amount of flexibility and being willing to adapt based on the circumstances that you face, I think.
Susan replies.
Great, thanks. So just as a reminder, if you have a question that you want to ask, you can press *1 on your phone and the operator will unmute your line. He'll let us know he's doing that. And while you're thinking about that, let me ask another question that's come in. Did any of you face either of you face what some people call unplanned scaling, which is regions hear about this new great stuff that's going on and try to take up the practice before you can support it with the strategies you've developed?
Cosette replies.
Sorry, I laugh. We did have a couple of regions that thought they had to already be doing it when we came to roll it out, and luckily we kind of caught wind of it during those pre-implementation discussions with the regions, and really come and say, don't try to make this up before we come, or then you're going to have your staff unlearn things. Just be patient. We'll get to you as soon as we can. And but that was a challenge. So we had to consciously communicate around that because people were eager, and and they got an idea or they heard a rumor. Or we had one group went up and met with the region that was implementing and wanted to take things back to their region. But anyway, that was something we communicated consciously about.
So that's the good news, right? People want to do it.
Yeah.
Jennifer, any experience with that in Tennessee?
Jennifer replies.
Yeah, we have some experience and stuff with that. We're moving a lot faster pace than we wanted to, but the biggest thing we have to look at is the fiscal consideration. And so that has been is how do you move what the region's desires are forward, also along with how do you finance it with the fiscal piece. And so we didn't really have, with our type of intervention, staff really don't have the opportunity to try to start it without having the formalized training from the model developer. The model developer actually delivers our training to staff. And so that does have, at this point, a price tag to it because we haven't built in the infrastructure to sustain. And our plan was to do that, but they're wanting it faster, and so then having to balance the fiscal considerations with the region's request so that we don't lose momentum.
Susan replies.
Great. So let me ask the flip side of that question. What do you do when it's some region or area's turn to come up in the queue and there's a lot of resistance there and they don't want to join in? How did you address that, or did you even face that?
Cosette replies.
I think we saw that, but we really addressed it through our pre-implementation period with the regions. And so it became a natural part of our process to address it and to consciously put that on the table and talk about what to expect and or to address what their concerns were. So I think we didn't, because we took that time in advance, we didn't face it, at the moment when we were wanting to bring it out.
Jennifer replies.
And that's really kind of how Tennessee went about doing it also, is we really addressed it right on the front end. And because we actually have our commissioner involved in this, that also gives us a little bit of support there, that regions have a little bit more kind of buy-in if this is where we're going, what do we need to do to get you on board. And then we really have very close communication through our implementation team with current stressors. I mean, we run up against every now and then resistance of this isn't working, we don't like this, and it's like, okay, so how do we address it? And we constantly just reassure them that, look, this is brand new to all of us, and so if you see something that's not going to work or isn't working, you need to bring it up now. And I always basically keep stressing is I don't want anyone to leave a meeting rolling their eyes going, well, that's not going to work because you were in that meeting and you contributed to that meeting. So I need for you to speak up. And we really try to create a safe zone so that people can actually speak up when they see things that they don't think are going to work. And how do we then modify it? How do we get the buy-in to make it work?
Great. Thanks. We really appreciate you guys giving us a lot of different insight into this. I think we have time for probably one more question, and we want to sort of think with you about how you really were able to keep your partners or stakeholders, so to speak, in the loop as you move through this scaling process. So, I think, Jennifer, you talked about communication. We know a lot of the effort is sort of going internally to the staff, right, in both of your states, but you have, stakeholders, providers, courts, et cetera, that you have to keep informed. Can you talk a little bit about, either one of you, how you kept that alive?
Jennifer replies.
Well, in Tennessee, we actually have a weekly newsletter that goes out. It's called the Open Line. So we're constantly discussing our interventions, sharing about that, doing celebrations when good things are coming in, a lot of testimonials. We have all kinds of brochures, working on posters. We have a website. So we've got some of those regular communication strategies. The other thing, though, that we have done is our commissioner and senior leadership actually convened a meeting. We have private providers that provide our foster care for our higher level kids, and they've actually sat down at the table with them on multiple occasions and explained what Tennessee is trying to accomplish with the 4E waiver demonstration, and still continuing to do so. We constantly are reaching out to our providers, and so they have an understanding of what we're doing. And then just by engaging the churches and our faith-based community in helping us provide space and resources for KEEP has also been a very strong communication strategy.
Cosette replies.
Yeah, and I would say this is what but some of the areas that I think we have done well, we have done presentations for our legislature, to individual legislators, some of our other key community partners. For example, as we're rolling out in a given region, we've done meetings with our legal teams, so with judges, with the Attorney General's office represents us, our guardian ad litem, our parental defense attorneys. We've done kind of hosted lunches for them and be able to explain what we're doing and what they should be seeing differently and give them the chance to give feedback and direction to us. And those legal partner discussions have been very helpful. As we're rolling into our other pieces, particularly around the trauma piece, we're having more involvement with the provider community. We're still early in that. But those are a couple of things we've done.
Cathy replies.
Great. Thanks so much. I think we're a wrap on our questions for today. We really like to thank all of our participants who were with us today, and particularly thank our presenters, particularly Cosette Mills and Jennifer Williams from Cosette from Utah and Jennifer Williams from Tennessee. My colleague Susan Maciolek for being on today. And also a special shout out to Lisa Merkel-Holguin, who's our lead for our waiver team at the Capacity Building Center. So she sort of honchos these efforts. So we want to thank all of those folks today. Also our partners at the Children's Bureau for helping to craft and provide us some feedback about the content for this webinar. So thanks so much to all of you.
Contact information. Lisa Merkel-Holguin can be reached at lisa.merkel.holguin@icfi.com. Cathy Fisher, Center for States, can be reached by email at cathy.fisher@icfi.com. Susan Maciolek, Center for States, can be reached by email at susan.maciolek@icfi.com. Cosette Mills, Utah Child and Family Services, can be reached by email at cwmills@utah.gov. Jennifer Williams, in Home, Tennessee, can be reached by email at jennifer.williams@tn.gov.
In addition, if you want to reach out to us, you can contact us. Here's information on our website as well as our general email and phone number.
The Capacity Building Center for States website is capacity.childwelfare.gov. The email address is capacityinfo@icfi.com. The phone number is 844-222-0272.
We really appreciate everybody's participation today. At the end here, you'll see references for some of the research that we used in today's webinar.
To access a full list of presentation references, please contact info@icfi.com.
We very much appreciate everyone's participation and look forward to seeing a lot of our state participants who are working on the waivers at the waiver meeting in August in Washington. So thanks so much for everyone joining us today.
And that does conclude today's conference call. We appreciate your participation.